Oh, let me hear your war cry. Oh, thank you for joining me another episode of Beating Cancer Today, the podcast where hope meets action. I'm your host, Kevin Hennings, a stage 4 colorectal cancer survivor. Against all odds, I defied the doctor's predictions and took my health into my own. Now, I'm here to share my journey and alternative methods that help me. But it's not just about my story. It's about yours too. Join me as we navigate through the challenges of cancer together, providing support, insights, and empowerment. Together, we'll beat cancer, one episode at a time. Oh, let me hear your war cry. Oh, welcome to another episode of Warrior Wednesday, brought to you in part by our new website, www.beatingcancertoday.com. You can still find us on just about every social media platform. But after meeting a series of censorship, I decided that I was tired of being stifled. So we decided to circumvent all of their efforts to stifle me. And we were able to secure an offshore server where we were able to develop a website making Beating Cancer Today impervious to censorship. This page is being added to, and we're building it up every day. So go check it out, beatingcancertoday.com. Follow, like, and subscribe all of our other platforms that we're on, YouTube and Facebook and Twitter and Rumble and Patreon and Brighteon.com. Boy, I tell you, we're pushing Brighteon.com because it's much like Rumble. It's been proven to be less censored, to say the least. But anyway, nevertheless, enough about that. Lise Alschuler is a naturopathic doctor with a board certification in naturopathic oncology, which is really the draw of my attention, and has been practicing since 1994. So she's been around for a while, and she knows a thing or three, so to speak. She's a professor of clinical medicine at the University of Arizona, where I hear is a big party school, by the way, but as she's the assistant director of fellowship in integrative medicine. So that's no slouch, right? So there's a heavy resume here that I'm going to skip over a lot of it, and I'm going to let her explain it because there's a lot of education, and she's got quite the resume. She's been invited to speak on over more than 100 scientific and medical conferences, and she's published peer-reviewed articles. Dr. Alschuler, I'm pronouncing that correctly, am I?
Yeah, it's amazing. You got it right on.
It's a privilege to have you here with us today. Please introduce yourself a little bit. I don't want to spoil it.
Well, I don't want to go into it too much either, but I think relevant to this topic, I'll say a couple things. One is that I've been practicing as a naturopathic doctor for 30 years, and about half of that, actually, no, more than half that, 20 years of that time, I've specialized in integrative or naturopathic oncology. And so this is near and dear to my heart. I feel like there's really, to be honest, I feel like integrative approaches to cancer should be the right and the privilege for every single person diagnosed with cancer. It's still a little fringy, but it shouldn't be. And so
I feel like that should be the first approach.
Absolutely.
The primary approach is kind of where I'm like my mind is going with this.
Yeah.
But go ahead. Sorry, I didn't mean to interrupt.
No. Yeah. So we're on the same page with that. So my professional career in many ways has been dedicated to using academic platforms, speaking platforms, writing platforms, training platforms to move that needle in the right direction. And it's personally relevant to me too. I was diagnosed with breast cancer. I'm really bad at math, about 15 years ago, and went through what I call an integrative approach to my treatments. I utilized conventional treatments, but also natural treatments, and feel like I was a healthy person throughout that entire journey. And fortunately, I'm cancer-free today. And so, I feel like I've walked both sides of this experience for sure.
So I didn't even talk to you about this. This wasn't even in the pre-interview thing. So listen, can I just, I don't want to be intrusive.
No, go for it.
Was it, what kind of breast cancer? HER2, triple negative, HER2 positive? Where are we at with this?
Yeah, so I had the most common kind of cancer, which was ER/PR positive, HER2 negative cancer, but and I did not have lymph node involvement, but I was young. I was in my early 40s, and um, the tumor was pretty big. It was almost 3 centimeters, and it had what we call lymphovascular invasion. So that makes it a more aggressive type of cancer. So at the time I was working at a cancer hospital actually. And so I knew a lot of oncologists. So I sent my pathology reports to all these different oncologists. I'm like, if you had this patient, I didn't tell them it was me. If you had this patient, what would you advise? And they range from super traditional conservative oncologists to really out of the box oncologists. They all said, you got to do chemo. And, after your surgery, you got to do chemo. I'd recommend radiation and then hormone therapy. So I did all that, but I didn't just do that. I did a lot of work on my diet. I did supplements. I did intravenous vitamin C. I did, I still take a lot of supplements. I'm a firm believer in dietary supplements. I think they really make a difference. I exercise. I have always exercised, but I stuck with that. I just really incorporated a lot of what I was telling my patients to do. And I did have some side effects, but I recovered really quickly. I recovered fully, and I'm feeling good today.
This is amazing. So, okay, so you hit it from every angle. You hit the Western medicine approach, the homeopathic approach,
Yep.
Functional approach.
Yep.
So that's kind of the same theory that I took.
Mm-hmm.
I did the Western medicine, and you know what? The Western medicine worked for me because I believe that the Western medicine did its job, and its job was not to eradicate cancer. Its job was to kick the can down the road, make it go dormant, suppress it. It was never going to pull it from the weeds, but it was going to buy me enough time to figure things out. And it did just that. It kicked the can down the road. And eventually, when it became ineffective, that's when, I started, my horizons were broadened by the change in lifestyle and all the things that I had to do to correct what was broken.
Yeah.
And what was broken, the disease was a symptom of it. But and I want to make sure I say this the right way because it's actually the first time I'm saying this. The disease, I think, was the symptom of what was going on. But my body was broken, and I had to fix what was broken because I had tortured my body for years. So I had to fix that, right? And that involves a change in lifestyle. So what you're saying is that you kind of went the same route. You hit it with the Western medicine, you hit it with the exercise, diet, all the things that we need to do to, self-care just in general.
Right.
Oh my gosh. You know what? It's not really self-care. It's just the absence of self-neglect. We should have been doing this the whole time. Oh my
but
goodness. You know
I
what?
think but sometimes I think we need a diagnosis like cancer I always call like this diagnosis, I think we all know we're dying, right? We're dying the minute we're born, one could say, but there's something about the diagnosis of cancer where your mortality is like right here. And everything gets clarified. So your values, you really start to, am I living the life I'm meant to live? Am I living with integrity? Am I, are there things I need to fix, as you say, on that level? Are there things that I'm doing to my body, as you say, that are not conducive to its health? Do I need to fix that? And it really helps motivate, I think, some positive change. That's the sort of bright side of it, but it still can be harsh, of course, for people.
Now, you incorporated some exercise into your change in lifestyle, your dietary changes and everything. You hit it from every angle.
Yeah, and I always say to my patients, let's just take everything we know that could be useful for this cancer, pull all the labels off. I don't care if it's conventional, natural, I don't really care. Let's just put it all out on the table and let's figure out what has the potential to be the most effective, the least harmful, the least risky. Is there something with good evidence? Is there something, maybe it doesn't have good evidence, but we know it's not going to hurt you? Do all these things get along well together? And then let's put a program together that works works well for you. And we have to be willing to modify it over time too. But I think that's helpful because sometimes I think people get stuck in this sort of either or approach, like either conventional treatment or alternative treatment, and it gets opposed to one another, and that's really not really helpful.
Yeah, so I have this Facebook group page, right? That this episode will also air on, and it's Beating Cancer Today is the group page, and quite often it's a debate as to whether Western medicine is effective, or it's like everybody needs a villain in their story, I guess. And I think people expected me to throw stones at my doctors and say this and that. Listen, I have no qualms, and I don't deter anyone from Western medicine.
Mm-hmm.
I say throw the kitchen sink at it.
Yeah.
Just understand what it's going to do, and it is effective. However, you got to know its job. If you think that it's, if I'm a plumber and you call me over to paint your house and I do a terrible job, well, you didn't understand my job then. You don't understand what my purpose is,
Mm-hmm.
So, and that's what people misunderstand, I think, about Western medicine.
Mm-hmm.
They don't have the cure because it's not a monetary benefit to anybody, but the cure is there, and I think it's not one magic pill. It's a collective effort of lifestyle and a reversal of torture, or whatever,
Mm-hmm.
reverting back to the caveman aspect, or, how Jesus lived, or, whatever, before we poisoned ourselves.
Mm-hmm. Yeah, that actually brings up something I think I want to insert here a little bit, because I think the cure can be there for some people. Not everyone will be able to experience a cure for their cancer. And, that's because each cancer is different in nature. Each person is different. And that's not the fault necessarily of the person, nor really is it the fault of the therapies that are out there. Cancer is wily, it's aggressive, it doesn't play by the rules. And so, it can be a challenge for people. And I just think that's important because some people, I think, feel like they fail when they are not making progress in the way that they're setting themselves up to do. And that's not necessarily their fault. In fact, you talk about beating ourselves up, but let's look at what we're doing on this planet Earth. I mean, sometimes people get cancer because the air is toxic, or the water is toxic. I mean, there's a lot of things that are sort of beyond our control too that contribute.
And I mean, some people have unrealistic expectations for, the cause and effect of what their solution or their selected solution would be, their choice of solution. And you make a very good point. In fact, I think in previous interviews, I've heard it before. There's a difference between cure versus control. You say that some people may not be able to cure their cancer versus controlling it. I mean, not everything is metabolic. Some things are genetic. There's some specific things in your liver that's genetic, I think, if I'm not mistaken. But I don't know enough to speak on it, and I mean, that's it. I try to stay in my own lane, but I do think that there is a significant difference between cure versus control, like you said.
Yeah, 100%. And I think that no matter what the outcome is, I think if people have the opportunity to utilize really well thought out nutritional therapies, well thought out activity recommendations, well thought out dietary supplement recommendations, et cetera, they can experience a much enhanced level of health, regardless of what's happening with their cancer. So there's that too. I mean, that's an important benefit. Even if somebody is controlling their cancer or lengthening their life by some unknown factor, if the quality of their life is improved while that's happening, I think that's a win.
Yeah, I mean, motion creates emotion, and I think that everything, there's other things, there's collateral benefits, the other things that come into play, that you benefit from as a result of making that change in lifestyle or whatever. But you indicated, and I don't know if I read this wrong, but you got sick after you were already in the field that you're in.
Yeah, no, I know, kind of ironic, right?
Yeah, so that's not what led you to the field that you're in. So what led you to specialize in naturopathic, which is a very specific field of oncology,
Yeah.
and what inspired you or your interest in this field? How did that happen? And then all of a sudden, ironically,
Right.
you got sick in that field.
Well, I was intending to be a medical doctor since I was in third grade, but it was really when I was literally on the threshold of entering into conventional medical school, I just thought, I can't do it. This is just not me. And I didn't know what I was going to do, but later I found the principles of naturopathic medicine, and I knew I had found my career, because naturopathic medicine is based on some really fundamental ideas like support the innate healing capacity within each person. So that presupposes that everybody has an innate healing capacity. We believe that doctors, the primary role of doctors, to teach people how to employ more healthy behaviors and so forth in their lifestyle. Using the least invasive, most natural therapies whenever we can. We have a ladder of intervention, so sometimes surgery is the best thing, but we try to kind of use the most natural things whenever we can. So things like that really resonated with me. So I did naturopathic medicine for quite some time, but I had always been fascinated with oncology, primarily because when I was an undergrad, I took a class, and we had these folks come up to the stage who had been diagnosed with cancer. One was a really young woman, one was an older man, and one was a middle-aged woman, all different ages, and so different kinds of cancer. And they just talked about their experiences. And I remember sitting there thinking, these are the kind of people I want to work with. These are amazing people. Like, there is nothing fake about them. They are telling it like it is. They have gone through the ringer. They have emerged with a very sacred sense of who they are, what the value of life, the sacredness of life. I mean, these are the kind of people I want to work with. So I was always had in the back of my head, I got to get back to oncology. So when I had the opportunity to do that as a naturopathic doctor, I took it. And before I was diagnosed with cancer, actually, my father was diagnosed with pancreatic cancer, and when he was diagnosed, was given a very poor prognosis. It had already spread everywhere in his body. And so he was told he maybe had 3 months max. And so, of course, he, like you and I, engaged in an integrative approach. He did conventional treatments, but he also did a lot of natural therapies. He did some clinical trials. He did everything that he could possibly. And he ended up living 17 months, which is pretty astounding given how spread out his cancer was when he was diagnosed. But most importantly, I remember sitting with him on a porch about a year after his diagnosis, and he turned to me and said, Lise, I just want to thank you for all the help you've given me, because I feel healthier now than I have felt in 30 years. So he felt good, almost to the very, very end. And so to me, that was a big, wow, there's a lot here in integrative oncology.
So, that's an interesting point, because I feel incredible. Like, I feel like I'm 17 and I'm almost 51. I mean, I feel in like it's not real, like, and I don't know if it's because I was sick for so long, I forgot what it felt like, whatever the case may be. But the doctors still tell me, oh yeah, well, cancer is going to kill you. I've had clean scans for over 2 years and 2.5
Yeah.
years, and I feel invincible,
Yeah.
literally invincible,
Mm-hmm.
and energy that I've never even. I can't remember having this kind of energy.
Mm-hmm.
Why do they keep saying that?
Yeah, that's something that medicine does really badly, which is we hex people. We really do. So people go in and they're told, you are going to die from this cancer. So what do? They die from the cancer. I mean, of course, maybe they would have, but why not just give people the opportunity or the option to live with the cancer or live longer? Like, just allow that possibility.
You know what? I don't, they do a lot of math. They talk a lot about statistics. They
Sure,
talk a lot
sure.
about, but they don't talk about anything, they give you a lot of statistics, but none of their statistics, the subjects that their statistics were based on were me,
Yeah,
or had the things going on in their life that I had going on mine, or have the support that I have, or whatever the case
right,
is.
right,
No two apples are the same here.
right.
So
Yeah, and I think it's good, and they should give you statistics, but then they should say, these are statistics.
yeah,
Now let's talk about you.
yeah. Well, typically there is no nutrition. Like I never met a doctor, an MD, who went through school and says, well, I came out of med school with all this nutritional knowledge. I've never met any of it. I've interviewed a lot of doctors, and none of them have told me about the chapter or
Right,
the semester spent on nutrition. So is it an oxymoron that you became naturopathic and naturopathic at the pronunciation of it? Um, is it is there an irony there that because that that's not something that you went through regular med school
right.
to specialize in?
Yeah, so I mean that's one of the reasons why I was really attracted to naturopathic medicine, was because this is a medicine that believes that what we put into our body is not only calories but is information on a cellular level, and the kind of information will determine how cells behave. So
Information on a cellular level. I'm going to just capture that for a second. Go ahead. I'm sorry.
so we have to really pay attention to that. And um, I think that most medical doctors don't know a lot about nutrition. That's one of the reasons I love the job I have now, which is to run an integrative medicine fellowship for these MDs and DOs primarily. And they come through and they learn a lot about nutrition. And, these are exceptional MDs. These are doctors who come in and who, because they recognize the lack in their ability to work with patients. But I think that it's, nutrition is complicated for doctors because of the way medicine is set up. When you start to work on nutrition, you're really working on something that's pretty important to people. We all eat a lot. We eat frequently. It has a lot of social context. It's culturally, there's just a lot going on with our food. So when you start messing with diet, you have to have time to spend with your patients. You can really work through how to make changes, not only understand why the changes and what changes to make, but how can you help people implement these changes, and how can they be changes that are sustainable? How can we determine if the changes actually are making a difference? I mean, it's complicated actually.
And there's a lot of defeat involved in that too. I mean, people go on a diet and people fail at diets. You got to change your lifestyle. It can't be a diet or a fad or whatever. You're sick. You know what? Just I really, I'm totally going to get mileage out of that and tell everybody that you said it, that what we put into our body is just information on a cellular level. That is awesome. You know what, Chris, as a producer, he's going to clip that one for us. That was so great. So anyway, I mean, because it's simplistic,
Yeah.
and
It's very true. I mean, but everything is like, really, we're constantly digesting. Yeah, we digest food. That's very tangible, but even emotions are information too. It's actually amazing. If you have a moment of deep felt gratitude, that's information that goes into your cells, and it literally alters an enzyme in your cells called telomerase, which will help to add more stability to your chromosomes. So when you feel gratitude, you actually are stabilizing your DNA, making your DNA more impervious to mutation. So that's information too. It's amazing. Like, we have so many opportunities to change the way our cells behave.
can we talk more about that? I'm sorry. I mean, like, Hey, can we talk more about that? Like less of me talking and more of you telling me more about that. um, no, because I mean, just the profession, the specialization itself is fascinating to me because it's such a major part of what this developing belief is personal to me.
Mhm.
Um, so can you tell me a little bit more about your message? The message from a naturopathic doctor.
Well, gosh, I mean, that's a really great question and one I haven't, I don't think, been asked in that way before. But
Took me like an hour to ask it.
I would say that fundamentally, I think as an naturopathic doctor, I believe in the inherent healing capacity within each person. And my job is to unharness that healing capacity in whatever way I can. And I can do that by removing barriers to healing, but I can also do that by providing information or support to that innate healing capacity. So that's really what I do all day long when I'm with patients. Where are the barriers to the healing? How can I encourage them to be removed or to remove them? The barriers might be they're eating a lot of processed, high sugar foods. The barrier might be they're in a toxic relationship. I mean, it could be lots of different things. And where are they? Where's their healing capacity needing help? Where do they need more support? Do they need more nutrients, more nutrition? Do they need more energy? Do they need healthier mitochondria? Do they need more, um, you know, flavonoids from vegetables and fruits and supplements to support their cell signaling? I mean, there's so many ways that we can support that healing capacity. So I guess that's how I'd answer it.
Well, I mean, that's a good answer. I mean, the, I mean, that's significant, right? I mean, because there's no limitations. I mean, really, your approach is not limited to Western medicine or homeopathic or functional medicine or whatever you want to define things as. It's a no label approach.
Right.
And I kind of say the same thing. I mean, listen, I don't really care what got me healthy.
Mm-hmm.
I give the credit to God, and that's where it goes for me.
Mm-hmm.
But I don't really care what you call it. I don't care where it came from. I mean, I'm grateful.
Yeah.
I'm grateful every single day. I'm grateful. So,
That's
I mean, for individuals facing a cancer diagnosis, what advice from your medical perspective, um, what advice do you have for incorporating the naturopathic principles into their treatment plans? Because there's no limits, right? So, what would you
right.
throw at it?
Well, so I'm going to start. This is going to sound maybe a little conservative, but hang with me for a second. So, one of the things that happens when you're diagnosed with cancer is you experience this tremendous shock, trauma, fear. And so we go to Dr. Google and we search all over the internet. And, it's because people are so desperate when they're diagnosed with cancer. There's a lot of charlatans out there and there's a lot of false claims. So I think the first thing to do is take a breath and step back and find some support that you can rely on to help you filter through that information so that you're really making good, solid choices. So, of course, ideally, if somebody could bring into their team of providers an naturopathic oncologist, and by the way, if they go to oncanp.org, which is the Oncology Association of Naturopathic Physicians, they can find one, hopefully, near to them. Or they can look for an integrative medicine physician, an integrative oncologist, somebody that has some knowledge so that they can kind of serve as a guide, if you will. There's some amazing holistic trained nutritionists. There's lots of people that people can seek. Because I think to do it on your own is not a good idea. Because even though, let's say somebody looked online and found an herb that, seems like it's going to be helpful, just because it's an herb and it's natural doesn't mean it's necessarily safe. It might interfere with a conventional treatment that could be life-saving. It might have cause other problems that could in turn really be damaging. So it's just important to get knowledge, get guidance.
I don't think that I could have gone through this battle by myself. I had things that a lot of other people, I was very fortunate. I had things that a lot of other people didn't have. I had a wife who was just amazing through the whole process. She shielded me from all of anything negative. Like you said, everything affects you, right? Your emotions, your everything. This was during COVID too. So the chaos in the world was going on. My wife, bless her heart, shielded me from everything. And my family was a tight knit family, and the support system that I put into place, I was very fortunate. And then I had, I don't know, I don't know that I was exposed to a lot of things because of the support that I had. A lot of people aren't fortunate like that. But I think that it's very difficult to go through this solo, for sure.
Yeah.
I gotta, and I'm almost hesitant to ask because I try not to ask loaded questions, in an interview.
All right, I'm ready. All right, bring it on.
You mentioned two things that caught my ear. You said there's a bunch of charlatans out there, but then you said there are no limits in your practice. So my question to you is this: what is your position on cancer being parasitic versus repurposed medicine?
Okay, well, let me first address the first things you mentioned, which is that, yes, I think that there are, I don't think that I said there are no limits, but I think what I would do in any case is just qualify that to say that when I am looking at any therapy that potentially could be helpful to somebody or a theory underlying what's going on with them, I apply what I call a benefit versus risk analysis. So what do we know about the potential benefit of this? How much evidence is there to support it? And what do we know about the potential risk, which can be the risk of the therapy or the risk of doing the therapy in lieu of something, right? Yes. So once I kind of put something through that risk benefit, then I come up with, okay, let's go with this or not. So parasitic.
That's the safest answer you could have ever said, ever. Ever.
It's true. I'm being honest. That's what I do.
That was great. Well, because it's kind of a taboo thing. Full disclosure, I found a solution in repurposed medicine, which we hadn't talked about before. So this is kind of loaded, I guess. I'm sorry for the surprise. So I found a solution in repurposed medicine. I went through the Western medicine gamut, and that my doctors were great. However, they exhausted all their efforts, and I was, sent home, and there was no, it was kind of, well, let's wait and see thing. They were done with their care, and so I took matters into my own hands, and I decided to do a deep dive, and I found a solution in a fenbendazole-based cocktail that I put together. But everything that I put together, all of the 5 ingredients that I put together, were all clinically supported by clinical trials through a major cancer institution. So it wasn't like I was willy-nilly, trying to commit suicide. Definitely not.
Right. Well, first let me just say that I recommend repurposed drugs in my practice routinely. And
that takes a little bit of pressure off me.
and there are more and more oncologists that are doing it too, because we're learning that these drugs, which were created for a particular purpose, do other things in the body. Surprise, surprise. And sometimes they affect growth pathways in cancer cells. So, fenbendazole is another example, is an example of something that I think is repurposed, but the way we talk about it isn't quite correct. It's not, I don't believe that cancer is a parasitic disease or caused by parasites. Okay. That happens to be an anti-parasitic medication that also affects growth pathways that can be turned on in certain cancer cells.
Thank you. All right. So when I started this, right? When I started this, I was under the impression that cancer was parasitic, and everything that I read was complementing that theory.
Uh-huh.
And so when I started this, and you know what, this is actually the first time I'm opening like this topic here. I always was under the impression that cancer was parasitic, and that's why whatever. So that's why the efficacy was so great on with fenbendazole. So that was what I attributed the success to.
Mm-hmm.
My success. I was
Mm-hmm.
so wrong. I
Mm-hmm.
feel like I was so wrong. Now I'm becoming more educated and I understand how cancer feeds.
Mm-hmm.
And I also understand the role that fenbendazole plays in the processing of how cancer is presented, or I'm sorry, how sugar is presented or glucose is presented and processed. So it's an interference of the process
Right.
of how cancer feeds. If I don't know if I'm explaining that.
Yeah, no,
Can
I
you
think that's
clarify
good.
that?
I think it's a good analogy. It's in part due to the metabolism, but there are other things going on that are more than just about making energy, which is essentially what metabolism is. It's There's also certain
The
signaling
mitochondria.
pathways within cancer cells that get upregulated or they get turned on. They're like stuck in the on position. They're overactive, so that cell is like under constant pressure to divide. And some of these repurposed drugs will interrupt or block some of those signaling pathways. So, and that's really the goal, right? So with cancer cells, they have so many different things, bless you. There are so many different pathways that are abnormal in cancer cells. And as a tumor starts to, as a cell, cancer cell divides, and then those cells divide and divide and divide. With each division, they're, those cells, those daughter cells, acquire more and more aberrations, more mutations. So there's more of these signaling pathways that become dysregulated. So that's why it's sometimes using multi-purposed or alternatively purposed drugs with other nutrients, with all these other things that interrupt as many of those different signaling pathways, metabolic pathways, all together at the same time as possible. That's where we can sometimes hit the magic, of having a cancer control strategy, because now we're not just targeting one pathway, hoping that that one pathway is going to kill the cell. We're just kind of touching it in lots of different places.
So, Doc, you're not the first person. You're not the first person to explain this to me the way you just explained it, and yet I'm still unable to regurgitate it. However, appropriately, I guess.
Mhm.
So, I guess my question is, if you know this, and my previous guests on other podcasts, they've known this. Why is it? Why are people still getting sick? Why is there a resistance to this as a primary treatment?
I think it has to do with the fact that um, a couple things. So number one, there no two tumors are even within one tumor. There can be many different cell population types, some of which will have certain mutations and others of which don't. So let's say along comes three different drugs that were used for different things. One's a hypertensive drug, one's a diabetes drug, one's an anti-parasite drug. You put them all in, they've all been shown to inhibit various growth pathways in cancer cells. But it turns out in this tumor that not all those populations have those aberrations.
Okay.
So that drug cocktail might kill off some, but not all. And so I think that this is why there's really, unfortunately, not one size fits all. There's not one cocktail that's going to work for everybody. And it even may be that one drug combination works for part of a tumor, but not another part of the tumor. Or it might work for a tumor at one time and not another time. So I feel like, honestly, if you ask me, like, what is the cure for cancer? I would say that I don't have a cure, but I do know that a component of the cure is that we always have to stay a step ahead of it and be willing to modify what we're doing over time to kind of address the constant changing nature of cancer itself.
Wow. So I always attributed the efficacy of say the fenbendazole based cocktail that I take, I always contributed that to when somebody started taking it, the stage of their battle of whether they could get ahead of it, in enough time, whether they could get ahead of it before it gets to them,
Well,
type of
there
thing,
is that. That's
you
true too.
know,
That
and
is
so there is that coupled with it, and I don't even want to say coupled with or versus. I'll let
right.
you clarify that, um, because like you just said, um, there's some things that one particular thing might kill some part of it, but not all of it, or it might not have the same efficacy on a different genetic trait or whatever the type of
Right.
situation it is.
I mean, in your case, you may have just been fortunate enough in the sense that whatever differences were within the tumor, that cocktail that you took and are taking happened to address enough of the differences across the board that it was effective.
Okay, that's very clear.
Yeah,
That's
right. So you're living testament to that. So, and I think but that same cocktail that you took in somebody with the exact same diagnosis on paper may not be as effective just because the mutations or the genetics of their tumor might be different. It could be. It definitely, I think should be tried for sure,
yeah,
but it may not work as well. They may need something additional or something different, or
yeah, and
that's what I
conversely,
mean. You have to constantly be like tinkering with it to try to figure out what
yeah.
could possibly work.
Yeah, I love that you just said that because conversely, I mean, like on my Facebook page, we have a few different protocols that are posted up there because I mean, if something worked for somebody, I don't really think that there's a one a magic pill, a one size fits all thing, because there's other people. I know that fenbendazole doesn't cross the blood brain barrier, and I know a lot of people play with the ivermectin. Well, you're not going to do it there either. You're going to need albendazole, membendazole. You're going to need some other type of drug that crosses the blood-brain barrier. So my cocktail is not going to work. But there's other stuff out there that does, and I would encourage people to explore that. That's why I have several of them, that worked for other people, not something that I came up with. But if there's clinical evidence to support it, I'll let, somebody put something out there, because who would have ever thought that I was going to be in the position I'm in, taking fenbendazole, or whatever. So, I mean, it's a horse medicine, whatever.
Yeah,
Um, but is that what did it as much as the change in lifestyle? Because I think that one has to go hand in hand with the
right.
other.
And maybe whatever conventional treatment you had beforehand set up a vulnerability that you then capitalized on. I mean, I think we just don't know what it is. But I think to your credit, you kept working at it and kept exploring and committed yourself to a path of healing and health. And, now you get to experience the results.
I think that it's so important, especially for our audience and the viewers, because everybody wants hope. Everybody wants hope, and they want to hang it on one thing. They want to hang it all. Like, and a lot of people feel. I hate to say this, like, well, the reason why they're in this state of desperation sometimes is because they just blindly followed the Western medicine narrative without keeping an open mind to other options, and I'm not saying one's better than the other or this or that or whatever. Not even a debate for me. I appreciate everything, so, but I think that, you know, when you blindly follow something without being your own advocate. And I think being your own advocate is a big deal, or else
Yeah,
you'll just believe anything. Right. So I think that if you blindly follow something and then you come to, Beating Cancer Today, Facebook page or whatever, and you start a dialogue with the chat in there or whatever, and people say, well, tell me what to do, tell me what to do. Listen, I could give you kind of a foundation of what worked for me, but I would encourage you to explore, whatever is scientifically supported. Don't get reckless, be
right.
calculated,
Right.
you know. And I don't really take anything off the table at this point because I think that there's no one thing. You're gonna have to put in the work.
Right. And, I think it's also important not to vilify oncologists because there are some really good oncologists out there working really hard for their patients. And, sometimes they have a therapy that's going to be amazing. I mean, immunotherapy is a good example of that. That wasn't even on the scenes, 10 years ago, and it's completely revolutionized oncology. So I
Yeah.
think that, there's some good things coming out of conventional oncology too, which is what you're saying. We just have to constantly be looking at, well, what is this person recommending to me? What are they saying it could give me? Are they telling me if I take this, I can get 2 more months, or this could potentially cure my disease, or this can control I mean, what am I going for here? And what have they seen? What's the toxicity? And then what are my other options?
Yeah.
And just really think it through and just try to make the best choices, the most informed choices possible.
Well, I know that things take time, but I do know that they're doing some clinical trials currently on fenbendazole and albendazole, and well, not albendazole, but ivermectin,
Mm-hmm.
in its relationship to cancer.
Hmm.
And but my curiosity is how many doesn't this take a long? I mean, in your experience, does to get through FDA and all that stuff, doesn't these things take forever if they're only doing these trials now?
Yes, it does take quite some time, typically, especially in a case like this where there's no financial incentive on the other side of it. Because in
Yeah.
order to patent these drugs are already out. So, yeah, it's going to take time.
But
But I mean, this.
everybody's getting cancer. I mean, the royal family, everybody's getting cancer.
Mm,
Like it's like there's all sorts of cancers, and and I don't know if pandemics and messing with pharmaceuticals and vaccinations. I don't know what if anything else contribute. I don't know, and I don't even, that's not even a thing for me. For me, we are where we're at. It doesn't matter how we got here. This is where we're at.
mhm.
And I mean, what do you attribute to that? I mean, how are we where we are when there are other things that seem to be more beneficial than what we're going with now? Like the
Yeah.
current, like there's, and I don't care where you get treated. I've been treated at the top 5 hospitals for cancer in the US. I've been treated at all of them. so I don't really think that it matters where you get treated because it's the same treatment. Like there's a cookie cutter approach to colon cancer.
Mhm.
It's so full fox, full fury. Like there's a cookie cutter approach. This is the drugs that you get. It doesn't matter if you're at Podunk, you know, backwoods hospital, get it wherever. It doesn't matter. So why are we still where we're at if there are obvious, like we're repeating something that doesn't work? Like, isn't the definition of insanity? Tell
Well,
me, give me an answer.
I think like with colon cancer, like those, so that full fox has evolved into full fury and fulfirinox. Like there is evolution, but it's slow because in oncology, for them to make a change that with when their weapons are so toxic, they have to really be able to show this is going to have a survival advantage. So that takes
That's fair.
time
That's
to
fair.
run those trials. And so that's one of the reasons why it's a bit slow. And to be fair, too, like those initial for colon cancer, those initial chemotherapy regimens have changed the survivability of colon cancer 100%. Like there's no doubt about it. More people survive colorectal cancer now than they did before those drug regimens were around.
Yeah.
Now, the people that continue to have metastatic or progressive disease, I think that's where we start to see the benefit of oncology sometimes starts to slide down a little bit and the risk starts to go up. And that's where I think, it's really important for people to like you're saying, to really be their own advocate and to continue to search for as much as they can. I mean, at the very least, if they're going to stick with the conventional oncology, which might be in fact the best choice, at the very least integrate lifestyle into them. There was some really interesting research that came out. Oh gosh, it's been, I don't know, maybe over 10 years now ago, where they took folks with stage 3 colon cancer and they were all getting chemotherapy, and they divided them up into two groups. One maintained their normal diet, the other went on a low glycemic load diet. So they lowered the amount of essentially processed and refined sugars in their diet, and they had a much improved survival over the people that kept their diet the same. So that's simple, but that's just an example of how you can use kind of an integrative approach and make a big difference.
You know what? Honestly, I changing my lifestyle was, and I don't want to sound cliche, oh, getting cancer was the best thing that ever happened to me. You know what it was? It really, honestly, it just was. I appreciate things more, and honestly, I I really didn't realize it back then, but I don't really like the old Kevin. So, like, I mean, if you are going to if you're going to beat this, I think you have to change your lifestyle. You have to change your lifestyle. And if you change your lifestyle, that includes the toxicity of negativity. It includes, the environment that you're in. It includes everything. Changing your lifestyle is not just your diet. It's everything. The people you surround yourself with, the things that you expose yourself to, that's a change in lifestyle. So for me, I think it's awesome. Like if you're not going to build back a better version of yourself, what the hell are you fighting for?
Hmm.
Why are you going through this battle if you are not going to build back a better version of yourself to bring something to the table?
Hmm.
Because the old Kevin wasn't worth fighting for. Like I got to build back a better version of that guy. You're right. So I think that the change in the lifestyle, well, that just complements your effort to build back a better version of yourself.
Hmm.
Because now you're not building on the same foundation anymore.
Right.
You know,
Yeah.
so
Well said. Well said.
I just, I'm, man, I'm so grateful that the things that you're touching on are things that I know that it doesn't matter who you are. You're on the fence and you don't know what to believe, what not to believe, or whatever. But everything that you're touching on is consistent with everything that I want to be real. Like
Hmm.
I want this to be a metabolic approach. I want there to be other, and I don't want the Western medicine option to be the end all be all. Because those people are the ones that are telling me that I'm going to die.
Hmm.
So if they're the only option and they don't have hope, what the hell is going on?
Hmm.
So I'm really glad that you have such a broad range and such an arsenal to bring to the battle. I mean, you going from so many different angles. And I think that if you don't like where this is going, you need to do something to change the narrative so you can control the outcome. And that means listening to you. So thank you so much for being here, and thank you for taking this time. And I know that we played hopscotch of time zones a little bit today, but thank you for everything. I do you have any advice of people to people that are currently going through this battle?
Well, I think what you just said is really profound, and I think that what you were talking about is adopting an attitude of resilience and self-advocacy, which is fundamentally the most important thing that I think people can do, because then they can take the next step and the next step after that, and eventually create a path, hopefully, that will lead them to better, bigger, more wonderful healing.
Doc, thank you. Gosh, thank you for being here. And you know what? Do you have anything you want to plug? What do
Well,
you got?
I do have. So I've written a couple books.
Yeah, let's plug some stuff, Doc. Come on.
All right, all right. So I've written a couple books with my co-author, and actually, she and I have a podcast as well, Carolyn Gazella. So we've written the Definitive Guide to Cancer: An Integrative Approach to Prevention, Treatment, and Healing. It's now in its third edition, and then we've written a book called Definitive Guide to Thriving After Cancer, sort of a smaller book about now what, the cancer is gone, or it's managed the chronic disease. Now what do I do is the focus of that book. And then we have a podcast that we host, and it's called 5 to Thrive Live. So we interview people and just try to give people information and different options that might be available to them. We explore all sorts of topics, kind of in a much more condensed format, perhaps, than what we're doing today. But 5 to Thrive Live is good too.
5 to Thrive Live. I had to say
Mhm.
it a couple times while I was writing it down to make sure I get 5 to Thrive Live.
Yeah, it's a bit of a mouthful, but it was based on our original kind of concept of 5 superhighways of information that we can modulate and in turn change the bodily terrain to
Why did you start
disfavor
with this
cancer. I know,
information,
right? Well,
Doc?
we didn't get to it, so you have to come on and listen.
Oh man, is there a Reader's Digest version? The five. What are the five?
So we talk about inflammation, chronic inflammation. We talk about immunity. We talk about hormonal influences, digestion, detoxification, and then we talk about kind of a nutrient-based avenue or metabolic, let's call it.
I love it. You know what? 5 to Thrive Live. I'm going to subscribe to that because that's. I mean, that's really where I think this whole thing is going. I think that this whole battlefield should be at the dinner table. I mean, I really feel. I mean, where we instead of fighting in a hospital from a hospital bed, fight from the treadmill, or walking your dog, or doing something different, with your diet, with your exercise, with your lifestyle, with your surroundings and everything. Oh my gosh.
Hmm.
5 to Thrive Live.
Yeah.
Okay. I got you. Doc, thank you so much for being here and taking the time with us. And I would love to circle back with more conversation about this. I mean, I know just personally me, the more I talk to people and the more interviews that I do, I it molds this is a living thing, it molds your opinions, it molds your education. I'm learning things, right? Like
Sure.
I don't have all the answers, and I'm sorry if people think that I do, but this is my church. This is where it happens, right? So I feel like if we continue to do this, circle back, maybe interview again, different information is going to come up, and I'm going to ask questions based on stuff that I hear on 5 to Thrive Live.
All
So
right.
I
Fair.
can tell you that. Doc, thank you so much for everything. And I hope to God that Chris, our producer, you could make this look pretty, but because she's definitely worth it. And I don't know, I don't think I did her justice here. So thank you so much, Doc. We will talk
Thank
to
you.
you very soon.
All right. Sounds good. Thanks so much.
All righty.